Patient-centered care.
So what is patient-centered care? Patient-centered care is patient-focused. This means providing care that is respectful of and responsive to the preferences, needs, and values of the patient. Patient-centered care recognises that patients are people first and should not be defined by their disease. It allows people to make informed decisions while managing their own health by working collaboratively with healthcare professionals. So why is patient-centered care important? Patient-centered care improves the patient's overall experience with the healthcare system and creates greater satisfaction with the quality of healthcare provided. This ultimately leads to a greater likelihood of better health outcomes for the consumer. This requires everyone in healthcare services to work in partnership to deliver care that is tailored to the patient's individual needs, supported by respect, dignity, and compassion. Patients are given the knowledge and motivation to participate as an effective member of the care team.
There are 4 key domains of care which comprise patient-centered care.
Holistic care.
Holistic care requires an effective partnership that responds to the true needs of the consumer by valuing the entire person and taking into account the way interconnecting aspects of their lifestyle affect their health as a whole.
Individualized care.
Individualized care is the personal health care that integrates the consumer's unique history, needs, preferences, and health concerns into one management plan.
Respectful care.
Respectful care is care that recognises and acknowledges consumer confidence in their own care, respecting their right to choose, and supporting their own strengths and abilities.
Empowering care.
Empowering care assists individuals to learn and obtain information about their own condition whilst promoting self-confidence, self-determination, and consumer autonomy to facilitate active participation in their own healthcare. Underlying these domains are 8 principles of patient-centered care that allow consumers to receive the best health whilst ensuring privacy and dignity are respected at all time.
Respect for patient-centered values, preferences, and expressed needs. Coordination and integration of care. Information, communication, and education. Physical comfort. Emotional support and alleviation of fear and anxiety. Involvement of family and friends. Transition and continuity. Access to care.
Within pharmacy, there are 4 main issues our patients face which patient-centered care can help to overcome. These are poor compliance, fear of the outcome, costs, and patient contact.
This is Peter. He is a typical example of a customer that you'd see on a daily basis. Now let's assume that Peter is new to your pharmacy and you have not met him before. He presents to the counter with a script for metformin. You are really busy at the moment and a couple of staff members short. It is the middle of the lunchtime rush and an order has just arrived without an invoice. There is no one at the counter, so you greet him and ask the standard questions. Has he had this medication before? Does he want a generic? Are there any allergies? You know that you're not really asking all the important questions, but you're too busy right now and intend to go through the medication with him in more detail once it's been dispensed. He says he's got some shopping to do, so he'll be back in 30 minutes. You quickly dispense the metformin and go back to the other issues you were previously addressing. This situation, whilst unfortunately common, does not demonstrate good patient-centered care practice. To identify the main improvements that could be made to this situation, we firstly have to identify where patient-centered care was lacking. By not greeting Peter and introducing ourselves, we are missing an easy opportunity to start forming a relationship with Peter. By not asking the important background questions, we are potentially missing information that might impact Peter's adherence to this medication. By not recognising that he requires further education and counselling, we are not providing adequate access to care and ultimately could be considered to have failed at meeting the dimensions required to provide appropriate patient-centered care.
Now let's readdress the situation with Peter and see how we could have improved his outcome by implementing key dimensions of patient-centered care. When we meet Peter, we will make sure that we greet him, introduce ourselves as the pharmacist, and try to establish a good rapport as we have not met him before and we want him to trust us with his personal health history. Rather than just asking him details about the script, we will ignore the fact that we are busy in the store and form a conversation with Peter about why he is here today and why the doctor has started to prescribe him metformin. Upon providing effective and empathetic communication, we learn from Peter that he has been diagnosed with type 2 diabetes and initial intervention on his part hasn't worked, so his doctor told him to take metformin. He doesn't understand what his medication does or how it will help, and he's really worried because his mother died early and she also had diabetes. By taking the time to individualize Peter's case and not just treat him by his script, we are now able to provide emotional and physical support which will prevent issues arising from lack of patient contact. We can provide Peter with appropriate and relevant information and educational resources about diabetes and how to manage it. This will improve his knowledge of his condition and increase his access to programs which can offer further aid, both emotional, physical, and financial. Furthermore, we will be able to monitor Peter's condition better, as he will trust us and return to us as his regular pharmacy, ensuring continuity of care. If he makes us his regular pharmacist, his family may also come to us, which might give us the chance to involve the whole family in the management of Peter's condition, opening doors to new issues and solutions to these. Ultimately, by taking the extra time and applying proper patient-centered care to our patients, just like Peter, we can hope to prevent the main issues from lack of appropriate patient contact, such as poor compliance, excessive costs, and fear of outcome from ever occurring.
So how do we implement patient-centered care into pharmacy? The role of pharmacy practice is evolving to focus around patient-centered care. The pharmacist's task is to ensure that a patient's medication therapy is appropriately indicated, the most effective available, the safest possible, and the best practice for each individual patient. By taking direct responsibility for individual patients' needs and desires, a pharmacist can make a unique contribution to the outcome of their patient's quality of life. At the end of the day, by investing time and care into our patients, we will improve their overall experience with the healthcare system and create greater satisfaction with the care provided, while they strive to achieve their health goals, knowing there is a supportive team behind them.